आजको कार्यक्रममा यहाँहरूलाई स्वागत छ। पर्सि चाहिँ हाम्रो मङ्गलबार चाहिँ कर्णाली डिस्कोर्स सोसाइटी र मार्टिन चौतारीको संयुक्त आयोजना अन्तर्गत छाक तार्नेदेखि सपना बुन्नेसम्म देखेको कर्णाली खोजेको कर्णाली भनेर नरेश भण्डारी र शुभ सेन दुईजनाले चाँदीको घेरा र अविस्मरणीय जुम्ला भन्ने किताबका रेस्पेक्टिभ अथर्सहरूले बोल्नुहुनेछ। त्यसपछि आजको एक हप्तामा चाहिँ करियर सक्सेस एन्ड इट्स इनाबलर्स फर नेपाली वुमेन एक्जिक्युटिभ्स इन अर्गनाइजेसन्स अ केस स्टडी भनेर डाक्टर ज्योति रेग्मी अधिकारी हु इज एन एसोसिएट प्रोफेसर एट द काठमाडौँ युनिभर्सिटी स्कुल अफ म्यानेजमेन्ट उहाँले बोल्नुहुनेछ। दिस इज अ डक्टर रिसर्च विच गट डन सम इयर्स अगो। त्यसपछि अरू कार्यक्रमहरू यहाँ हुने कार्यक्रमहरू तय हुँदैछ, सो दे आर नट लिस्टेड इन दिस प्रोग्राम। तर दुईवटा अरू पुरानो पछिका कार्यक्रमहरू चाहिँ लिस्टेड छ। हामीले सोसल साइन्स बा नेपाल मधेस फाउन्डेसन र नर्थ साउथ कलेक्टिभ मिलेर चाहिँ फ्रेडरिक गेजको रिजनलिजम एन्ड नेसनल युनिटी इन नेपाल भन्ने किताब निस्केको 50औं वर्षलाई चाहिँ हामीले चाहिँ त्यसलाई सेलिब्रेट पनि गर्दैछौँ, डिस्कसन पनि गर्दैछौँ। त्यो चाहिँ जुन 27मा शुक्रबार 3 बजे चाहिँ त्यो यहाँ होइन कि नेपाल टुरिज्म बोर्डको हलमा हुन्छ, त्यो यता प्रदर्शनी मार्गमा। सो 50 इयर्स अफ फ्रेडरिक गेजेस रिजनल एन्ड नेसनल युनिटी इन नेपाल, यसको दुईवटा कार्यक्रम हुँदैछ। एउटा काठमाडौँमा, यो हामीले अनाउन्स गरेँ, अर्को चाहिँ अर्को जनकपुरमा हुँदैछ, which is on a separate day. On 29 June, there is another discussion, seminar here, research seminar, saying protection through mobility restrictions, experiences of Nepali women migrants in domestic sector jobs. Wanda Arjun Kharel, who is a colleague who works for the Center for Study of Labour and Mobility in Social Science, he will be speaking on that too. Our annual conference, which takes place the last week of November, the call for abstracts went out several months ago. And the deadline is coming very fast, June 22nd. So if you're interested in presenting your research in that conference, it will be a 3-day in-person conference. So if your paper gets accepted, you have to be physically here. So we're not going to be entertaining any Zoom sessions. We didn't do that last year either. So if you plan to attend the conference, you'll have to be here in person. So the deadline is coming, the abstract submission deadline is June 22nd. We expect you to submit a full-length paper of roughly 5,000 words by October 30, which leaves a lot of time to actually get the paper done. हाम्रो यहाँको चलन अनुसार चाहिँ we go around the room introducing ourselves, short नाम र just like affiliation, what have you. And once that is done, I'll introduce today's speakers and the context in which we are having that discussion. मेरो नाम चाहिँ प्रत्युष हो, म यहाँ मार्टिन चौतारीमा काम गर्छु।
Namaste. I'm Alex Yu, the PhD candidate in anthropology at University of Toronto.
Hello everyone, I'm also a PhD student in the University of Texas at Austin.
You have to say your name first.
Oh, sorry. My name is Rehan Khan. Yeah, I'm from Taiwan.
नमस्ते सबैजनालाई, म गौरव गरिसानी, म चाहिँ एन्थ्रोपोलोजीमा पिएचडी सकेर फर्केको नेपालमा अहिले चाहिँ
Namaste, I'm Helen Silva and I've been working on development working in the education sector.
म देवेन्द्र केटीमै काम गर्छु।
Namaste, म प्रणव खरेल।
Everyone, I'm Ishan. I'm from anthropology at the University of Colorado.
Namaste, मेरो नाम अनुषा, म चाहिँ undergraduate student, म चाहिँ चौतारीमा intern गर्छु। मेरो नाम चाहिँ सञ्जना मत्ता, म यहाँ काम गर्छु।
नमस्ते, म Anup Subedee, म चाहिँ infectious disease को डक्टर हुँ, Kirtipur अस्पतालमा काम गर्छु।
नमस्ते, म रामिला आनुप स्टुडेन्ट। नमस्ते, म विशाखा श्रेष्ठ, सोशल साइन्सको विद्यार्थी, अहिले चौतारीमा काम गर्छु।
नमस्ते, म मणि दाहाल, म नेपाली मिडियम।
नमस्ते, म डाक्टर सुसन हेydon।
नमस्कार, मेरो नाम पास्कल।
नमस्ते, म श्रेया तामाङ।
नमस्ते, म देवराज मार्टिन चौतारी।
नमस्कार, म रविन्द्र भण्डारी, म पनि सेन्ट्रल डिपार्टमेन्ट अफ एन्थ्रोपोलोजीमा रिसर्चर।
Now I'll switch to English. We've all gathered here today to actually hear the author speak and about her new book. It's a great pleasure to welcome Susan Heydon, Dr. Susan Heydon back to Chautari. She's been here before. Susan has been visiting Nepal for a very long time. And she spent a considerable amount of time in Nepal in the past, 2 years in particular in the Everest region. that led to our doctoral research and our first book. It's called Modern Medicine and International Aid, Khunde Hospital, Nepal, 1966 to 1998. This book got published in 2009. And then she's been working on the history of medicine in Nepal and has been publishing article-led stuff in various places, including one in 2019. She published an article on a special issue that editors of SINAS put together on the 50s in Nepal. That was part of our very long effort to put together a bunch of articles on the long 1950s, and Susan's article got reprinted in the book Nepal in the long 1950s that got published in October of last year. So I recommend that if you're interested in her work, in her previous work, that you look for them in various journals, including in SINAS, and which has been reprinted in that book. She's been working on the history of smallpox and efforts to get rid of smallpox in Nepal for a very long time. So her earlier presentation at Chautari was on that subject when she was, in a way, only beginning to do that research. And we're very happy to say that she's been pouring through archives in 4 continents to get the book done. The book got published as Implementing a Global Health Program, Smallpox and Nepal, by Manchester University Press in February of this year. I'm not a Manchester United fan, so I have no idea. I have no idea why did I say Manchester United. In fact, I am the fan of their rival team, Liverpool. So I have no idea why I said Manchester United. Anyway, I will circulate this book. Please make sure that it comes back to me at the end of the discussion today. I have just finished reading this book this morning. Unfortunately, copies of the book are not available for buying in any of the shops in Kathmandu. We're working on that, so we don't know exactly when that might happen. But Susan's a copy that was sent to us by the publisher for review purpose in the journal Studies in Nepali History and Society has been read by a reviewer who is also present in the room, and that's Dr. Anup Subedee. And the book's now actually been deposited in the Martin Chautari Library. So as far as I know, as of today, that's the only copy that's available in any public institution. And so if you want to read the book, you'll have to check it out from our librarian and read it in our back room, reading room. We are hoping that a South Asian edition of this book or a Nepal edition of this book will be out some point in the future. We don't know exactly if and when that will happen. So the format for today is, and I should introduce our discussant, which is Dr. Anup Subedee, who, as I said, has already read the book, has written a draft of the review. The review is going to be published in the journal Studies in Nepali History and Society in its June issue. It's being edited as we speak on the part of the reviewer. It will be edited by members of our editorial team eventually when the final copy is submitted. So, but it will go into the June issue, which we should be able to send to the press by sometime middle of July or even earlier. Our format today will be, Susan will speak roughly for half an hour about the book. She has several slides, and she will share whatever she thinks are the important aspects of this book. Then I've asked Anup to speak and comment on the book for about roughly 10 minutes. So in roughly about 40 minutes from now, we'll be done hearing from the two of them. Then I would request Susan to respond to anything that Anup has to say as part of his comments, and then we will eventually open the floor for questions and commenting. So Susan, it's all yours now.
So thank you very much for inviting me here to talk about my new book that you can see pictured here. It's a privilege to have such an audience, and some of you here have helped me in so many ways. Thank you. So I want to begin just with a brief outline of what I want to talk about, and to start by, as I say, reminding us about smallpox, a disease that no longer exists, and the global smallpox program. Then moving on to writing the book, method and sources, before getting to Nepal and how it succeeded with smallpox. And those pictures from New Zealand, so how does somebody from New Zealand end up writing about Nepal? So smallpox was a devastating communicable disease with very high mortality rates, and I can see in bold. There was no cure, or there is no cure, but since the late 18th century, it can be prevented through vaccination. Now, there's a couple of points here on this slide that I just want to pick up on. Implementing smallpox program, something that was important factor in its favour is that smallpox only involved human-to-human transmission. So not like malaria when there's other agents as well. And then smallpox, a global program, a mass vaccination program, a campaign. But if you're going to implement any campaign, you've got to have a suitable vaccine and method of delivery. You've got to have an appropriate supply, storage and distribution system, people to administer the campaign from the centre to those in the field vaccinated, and people to be vaccinated. So all those are essential to implementing the programme. So while many countries had eliminated smallpox, in the early 1950s there was still around 50 million cases of the disease worldwide. What this slide here just gives you an overview of the global programme from when it first began, 1958-59, went through to the intensified programme in after 1967, through to finally 1980, when the World Health Assembly declares smallpox eradicated globally. So that's the context, that's the background for which you have to see what happens in Nepal. Now, to tell you a little bit about how this book came into being, but I came with my family in 1996 to be volunteers for Sir Edmund Hillary's programme in the Mount Everest region of Nepal. And that's where we spent 2 years. And as Patricia mentioned, it also became the topic for my PhD. But in terms of the sort of the smallpox story, it's perhaps, I knew about there had been an epidemic in 1963 in the mountains, but it was a conversation with Dr. Lakbanobu Sherpa, who is here today, that was really what set me off on this, and the inspiration for this book, because he told me not about vaccination, some of that was, but about the disease and the devastation, awfulness for families, for communities. And that's really what sort of, that idea, I stored it away because I still couldn't get to do anything. It was actually a decade later, and that's not long after that when I came here, when I first did the talk. My colleague was Dr. Sanjoy, or Professor now, Sanjoy Bhattacharya, who's done a lot of work around in global health history, but particularly on smallpox eradication in India. And I was visited one day, and he said to me, why don't you research smallpox in Nepal? Because he'd done a lot to challenge some of the global sort of narrative of how it was being told. He knew Nepal had a different story. And it was through him that I was able to go to Geneva, and we did a talk there. But that got me sort of started. Now, another picture here that I'm sure many of you recognise, Professor Haman Dixit. He's been an enormous help to me in Nepal since my PhD days. I happened to find an email, and I wanted both to thank him for the work that he'd done. And since then, he has been helping me, and some really valuable materials came back sort of that way. Other people I began to meet and links, but the way I was gathering sources, particularly whether it was an interview in a field in Thane, which is that top image, or at WHO, and many institutions, people in between, things that would give me multiple perspectives, because that's the story that I wanted to tell. As it sort of slowly evolved, here Kieran Bhattacharya, he took me out to his hometown of Kirtipur, where it's been very bad, and we did interviews, and this was where I heard all about the loss of children, caring for sick children. So this was, as I say, a disease that faced people, and some of you here may still have some memories of smallpox, the disease. As I say, I was doing this sort of on the way. There's mention of an article here, because I found in London the documents that showed that it was government officials in Nepal that asked the British for vaccine, not the other way around, which is how it tends to get told. In the later stages, COVID did interrupt. We continued things on by correspondence, by emails, but it meant that I wasn't able to meet people in person, look and follow up on some of the further aspects. So all this during this time was gradually sort of coming together, and this is in the end the outline. This is the book that it ended up, and so starting from that sort of initial literature through to setting the scene through to the 1963 epidemic, which is sort of missing really from the official record, to engaging global policy, its gradual time transition, gradual implementation of an eradication, so moving from control to eradication, its steady expansion, and then finally the success. So what I wanted to do, as I say, why this structure is, I'm a historian, but I tend to work in health sciences, and so therefore I wanted to be able to put the medical and the historical and put it into, do a case study from local to the global, but over a longer period of time than the global program, put it in wider context, and then by using a wide range of sources, from talking to individuals through to the WHO archives and many, as I say, institutions in between, to gradually put together multiple perspectives. There is no one sort of story. As I say, COVID influenced the latter part, but what happened in 2020, it also made what I was doing topical. The 2020, the 40th anniversary of the programme, the Director General talked about lessons which could be learned from the victory over smallpox to combat coronavirus today. But what we learn depends on what we are told. And for the Director General of Health of WHO, these were basic public health tools that I put here: the surveillance, the case reporting, contact tracing, communication campaigns. So, as I say, these public health tools. Then, so this is what the story that was being told. Later, there was an official history done of the global smallpox program, published in 1988, and this is the cover. It's not popularly known, the Big Red Book. It's vast. It's sort of 1,500 pages, so nobody looks at it. Absolutely fascinating, but way too big. But it tells this top-down, centre-led story. And as you'll see, very different to what happens here. So, but for Nepal's story, that official history is important because it is the only published account of smallpox, the smallpox program in Nepal. And what is fascinating is it actually just says that Nepal was successful for different reasons, and it's the only country where this is acknowledged. So it is a very important account. And it goes on to say Nepal succeeded because it adapted the global program to Nepal's environment to make it work. And it did this through effective decentralization, the district supervisors who became key to prompt response, local vaccinators who were more trusted, and the vaccination campaign that was a strategy that changed in 1971, aligned with people's long-standing beliefs about when best to vaccinate. Messages that today are more familiar with COVID, but this is Nepal's story. Now, moving on to, as I say, the Nepal's story. Now, I don't have to tell you about the enormous challenges, not just to implementing the smallpox, but to implement any health programs in Nepal, whether it's geographical, educational, infrastructure, communications. But other audiences I have to tell because they don't believe just what it was like. And again, smallpox in the early 60s, in Nepal it was still widespread, but there aren't any statistics. And other diseases were considered more of a problem. We know from talking to people it was much feared. We know there were epidemics every few years. We know that people were looked after at home. Actually, they did better at home than if they'd been in institutions. We also know that there was variolation, which used live smallpox matter as practiced. And also that people thought that vaccination did work, but they were unable to access it. So this is the sort of situation in the early 60s. What I also need to do is put some wider international context of this period around this foreign aid was poured into Nepal, and there was this belief that technology and foreign experts had solved the health problems of the developing world, whether it was malaria, smallpox, whatever, you just could do it. But what has come out is in Nepal, because of all the other problems, they struggled in this early period. So I now just want to mention this book because the book starts with 1963. That was my introduction to smallpox, and this, although it's chapter 4, is actually where I start in the book, where I started my research, trying to piece together what was happening because there wasn't it hadn't been written about. So what I do is I have what I call 3 snapshots of 3 quite different areas. The Mount Everest area, the Kathmandu Valley and Lamjung district. It's mostly written from the perspectives of talking to people and from whether it's local people, but also the foreigners who got caught up in helping with that. But what that does is really just illustrates this many and fragmented responses that tell us about what the situation was like at this time. So now far too many words on this slide, but I'm happy to talk about some of these things later. But it does serve the purpose because it's the only way I can actually put an overview from the early 60s right through to the certification that smallpox had been eradicated in Nepal. So it takes it from this early picture, the limited responses, the pilot, government WHO pilot, the community is really important, community scheme down in Morang and Sansari, through to the intensified program as part of the global program, talking about the decentralization, also important new leadership, both the national head and the WHO advisor. They provide enormous consistency at a time of enormous change. The WHO supplied vaccine. Nepal never manufactured its own vaccine. And then through to change in a new vaccination strategy, which time frame, time limited, but actually freed up the local staff to work on surveillance and containment. The program becoming nationwide, the last case in 1977, the success. But it enables me to put it there on one slide. Now, it took time to develop. This doesn't happen overnight. So this, for clinicians, it remained a diagnosis to consider as this story tells you, the doctor at Beer Hospital will let you do that. Now, something I do just want to mention a bit about is just to talk about vaccination, because it is such a topical area too in global health today. Now, the official history focuses on beliefs, but I think is much too narrow, because beliefs influence actions, but are part of a whole spectrum of factors that might include the vaccine itself, the vaccination methods, practical issues such as access or presence of cases. Sometimes those factors were separate, but often they were linked. So if you had a bad reaction from something, you'd be less inclined to get another one. So we need to think much more broadly around it. And so this idea of a spectrum of beliefs and practices. Today we're thinking more in terms of vaccine hesitancy, but even I think that is not, doesn't take into account some things. So I want to move on to, and I think I'm all right in doing it, but for time, is that this is the, in the official history, this is what was considered particularly important for district smallpox supervisors. And I put in quotes, vital element. Those are the words that are actually are used. What we need to know here at the time with the whole setting up of the programme was the enormous political, social, administrative change that was going on in Nepal at this time. And importantly, the programme that develops does work in with those changes. And so what we have is, in the new constitution, we have 14 zones, each with a varying number of districts. After 1967, we've got the 75 districts. And what happened was that in each of those, the varies in terms of setup, but in each of those districts, there was a smallpox eradication program. And what is really fascinating, because when you actually read it, you find that it developed as planned. Even if when it seemed so ambitious when it started, it spread to each zone, each district, as it was intended. So I think it's an extraordinary sort of what happened. Training was really important, and there was extra WHO support for that. And what was particularly important about the training, and as you will see, both when they're having to focus more on surveillance and containment, but the way this scheme worked was the centre had to rely on the district supervisors, because if you go back to the challenges, an outbreak in the far west, you can't, it could take, as the documents say, it can take weeks to get the message happened. You can't manage. You had to rely on the district supervisors. Now, it was variable. There were limited personnel, limited resources, and in fact what happens is, some it works well, some it doesn't. Not everyone has a district supervisor. There may be an assistant, there may be somebody supervising. Now what's really important here, as I put in the quote, they were recruited and trained by the program, but they didn't have, these were not health workers, these were other people. It was good. There's a wonderful letter that says, can't you get somebody more, senior to check? Why should we can't, this was the regional office, we can't rely on them. They did. And it shows what can be done. As I say, it took time, but what I want, this is a story from 1973, and what I think is really, this team goes out from the centre, a Nepali doctor who I've had many conversations with, and WHO technical officer. At this point, they've had notice that the outbreak has been reported, so the centre are going out to investigate. It's quite a journey to actually get there, but what they find, and I think it is worth they found that everybody who was supposed to be in their centre and in the surrounding village had been vaccinated. They'd no new cases. They'd worked out where the source. The centre team decides nothing more for us to do, and finish it. The containment was very well done, which is noteworthy, since this was the district staff's first experience with a smallpox outbreak. He became a very experienced district supervisor, and he came in new sort of later, Mr. Chautari. And I think there's a quote from, at the bottom of this slide, from the head of the global program, Dr. D.A. Henderson. I feel there is something here which might well help other programs. So this was an acknowledgement from the head of the global program of Nepal's system that had developed. So, these are just sort of briefly some of the points. To start just bringing it together as a conclusion. What so often happens is that Nepal's many challenges are usually offered as reasons to explain failures or not working as well as those two. And so what I found was the focus of the book had to be on why the smallpox program succeeded. It became the first nationwide healthcare program. So I found it important that we needed to look with a longer and a wider lens. We need to put it in that wider context of considerable political and social changes. Key political support from the King, who supported the program. Community participation, trust, important. And so if you take into account all this, the program adapted to, as I say, Nepal's physical and human environment. So if that, as I've just talked about, effectively, not just decentralised, effectively decentralised, with those important role of the district supervisors using local vaccinators. And then the vaccination strategy change in 1971, which became time limited, but it aligned with people's beliefs about when best to vaccinate. And the number of vaccinations went up. And then freed up staff time despite a short period for surveillance and containment. It was a long-standing belief. I found it when I was writing the article about 1816. That actually emerges sort of there. And I think what at the bottom, the legacy of this program in Nepal has been expansion and support for vaccination because of this. And then just leading to my last slide, because Nepal's smallpox story is still important, and not only for Nepal, because the reasons for Nepal's success remain relevant. A program needs to reach people and be accepted if it's to succeed. I also feel that we need to bring the local into the global health narrative. It's not just what happens at the top. It's not even what happens at the levels it comes into a country. We need to look and take it all the way down, because when it comes to actually implementing it, it was complex and varied, and a lot of luck at times. But I think one of the presentations of the conference talked about, is there any hope? And when we look at all the problems, not on health, but this story here, I think Nepal's story is about what can be possible despite seemingly overwhelming challenges. So I think for that is a story of some hope. And then the last little comment, the global program's success involved more than just the basic public health tools outlined earlier in the global, as the Director General Health said. So important, but we need to bring in not just a little bit, but we actually really acknowledge that whole wider context. So thank you.
Thank you, Susan. In my enthusiasm about talking about our new book, I forgot to say that Susan is also an associate professor in the School of Pharmacy at the University of Otago in New Zealand. Now I'll ask Dr. Anup Subedee to make his remarks. As I said, Anup's read the book and he's written a first draft of the review.
Namaste everyone. So thank you, Patricia, for giving me this opportunity to read this book and talk today. And the main interest for me when I said yes to coming and talking here was to meet Susan. Because I read the book and I said, wow, it's something we should have done as Nepalis, and we should have been doing things work like this. And this is this is soon the way. So I wanted to meet Susan and hear her, both about her experience of writing this book itself, and just to get to know her. So I'm glad I'm here, and thank you all for coming. So I'm a physician by training. I have some public health training to a degree, but I really haven't done much work in public health except during the COVID pandemic. I wrote a few articles and talked about public health management of COVID and other pandemics in certain forums. And so when I come to review this book, I come as someone who hasn't really got to read any of the primary source materials that she has read. I wouldn't say any, but most of the primary source materials that she has read and Susan has gone to 4 continents. She has read archives in 4 continents and summarized those in this book. So it's a very significant, very hefty enterprise. So I come as someone who hasn't really gone through the reviewing most of those things. So my perspective would be very limited by because of that. And first of all, what struck me was the fact that she managed to find so many resources in a country where we don't have this culture of story keeping. We don't really. It's probably when it goes in like oral history, how people report their experiences, but we don't really write them. And especially about these big programs, I mean, we don't write them as a society, as a state. We're not good at doing that story keeping or record keeping, and so it's very hard to find relevant literature, source materials, and I mean just the huge list of resources that she went through is already very impressive, and she has been very thoughtfully and extensively tried to connect with people, bring out stories of the people as they experience the smallpox as a disease, as a public health scores, so she's gone through personally interviewed survivors, witnesses, people who were actively leading or participating in the smallpox program, and so she is able to bring the side of the individuals, communities, on this add that perspective to the global smallpox history. So that's very impressive. It's a labor of love, obviously, because smallpox is a very well policymized story. The global smallpox program, one of the greatest feats of mankind, and there has been, as Susan has stated very clearly, there's a very well constructed narrative, and very little there is very little room, or at least motivation. You can find very little motivation to challenge that, because it's about something that's already gone away, and there's probably going to be much less interest to hear about like a country like Nepal, how it handled that program. It may not get very much interest to a lot of people, even in Nepal. So to do that as an outsider, so that's a labor of love for this country, love for the people here also. I'm very thankful for that. She has very conscientiously tried to avoid the outsider lens or the top-down lens, that she mentions. She has also, I mean, because she has taken the longer view, she has also been able to, point out where the assessments of the experts coming from the WHO or even the local, people who are supposed to know the land, were making flawed judgments. She has able to point out where they were wrong. For example, there was this discussion about whether the smallpox vaccination program or the eradication program should even work in the mountainous areas in the Himalayas, because it's very cold there. There probably isn't smallpox, but she has shown in the 1800s there were Indian some secret missions too, right? Who were people coming in these missions and reporting there were epidemics going on in the mountainous areas in the Himalayas. And so even people in Kathmandu were probably not aware of that, even government officials were not aware of that at some point. And what I find the most interesting for me as a student of public health in Nepal is what it reveals about the early days of the development of the healthcare system in Nepal, and what parallels we see between then and now, and what we can learn from them. So in the 1960s, when the smallpox vaccination programs were started, and then it developed into the eradication program, or adaptation of the global eradication program, the country did not have the basic public health infrastructure at all. And so the initial discussion was whether the country should use its limited resources on the basic healthcare system in developing a public health system rather than focusing on one disease. Most government officials initially wanted to prioritize the development of the basic healthcare system. And then probably with pressure, or because there was fund coming in from the WHO and other incentives or nudges, the government decided to focus on smallpox. Earlier, as Susan mentioned, we had 40% of our healthcare budget was used in malaria eradication program as a development project. And so we chose to focus on smallpox. And we still do not have a basic public health system. What I mean by that is, for example, our municipalities or our provinces do not have the capacity to, do outbreak investigation, do the grassroots public health surveillance, data management, and isolation or quarantines, institute those measures effectively in a timely manner, monitor the disease and control it. We do not still have that. I mean, we may have some capacity at the federal level, but we do not have that capacity at municipality level. We get cholera outbreaks and typhoid. We see patients every summer or rainy season, and then so our communities are not designed, or our community governments, our local governments, or provincial governments are still not designed in a way that they see this as their basic responsibility still. And you can see the roots of that in the early conversations that we had when we were thinking about how to develop this smallpox program. Also the other part was our focus from the beginning has been towards hospital-based care rather than community-based public health care. So even now, if you see people talking about healthcare, if you see the budgets being allocated by the government, or the daily pronouncements by the health minister, it's about hospitals, it's about doctors, nurses, rather than approaching healthcare from the public health perspective. We still prefer to talk about hospitals. And that was a problem, as you can see, not just from Nepal side, but also from the WHO side. If you look at their communications, their surveys, they report on first of all, we only had doctors and nurses. We didn't really have public health experts. We didn't have expertise for public health policy making and strategizing, and that's why we heavily relied on the WHO and the experts. But how do we develop our healthcare system? When that conversation started, we still were focusing on doctors and the hospital workers rather than public health experts, epidemiologists, or statisticians, or like the environmental health or behavioral health experts. So even now, when there is a talk about who is going to be the secretary at the health secretary at the Ministry of Health and Population, there is always this demand from the doctor's side that it must be a physician, it must be someone who has got an MBBS. If someone who has got an MBS or somebody who has background in public health but is not a doctor becomes a secretary of the Ministry of Health, there's a huge outcry from our doctor side. And so there have been only a few exceptions where non-doctors have become secretaries. And that tells us about the psyche of our healthcare system, and one of the reasons for our failure, why we have not been doing well, why we still have this basic dysentery or diarrheal illnesses is still creating havoc in this country. And you can see the origins of that problem in our initial thought process when we're developing the system. And even the WHO, they were, just reading Susan's book, I haven't read any primary sources, of course, but reading Susan's book, what I come away with this idea that the WHO did not think that was necessary for the country to have these experts in the public health side. Some of our top leaders who were doctors who were chosen to lead the program went overseas to study public health during the course of this, in the 60s and 70s. But that was after the fact, and that was just very few people. And so WHO took it for granted that they were the ones who were going to run the public health side, who were going to run the policy side of this program. They really did not think that for this country to have a sustainable public health system, you need to empower them to design their own path forward. And the other parallel that you see is how the government views the citizens, how the state views the citizens. In the 60s, when vaccination program was first started, it was compulsory vaccination introduced at the Dr. bus station. Susan mentioned some stories where people were just, they were forced to vaccinate. Even in the early 70s, some nomadic tribes, probably tribes from like Santhals or Satars, who were coming from between India and Nepal, they were just forcefully vaccinated. Well, in the 70s, we already had a Public Health Act. Sorry, I forgot the name. The Infectious Diseases Act of 1964. When people were forcefully vaccinated in 1963, that was before we had any act that would allow the government to do so. And the state could do that because that's how the state viewed the people. They were just forcefully vaccinated people. And the heavy-handedness and coerciveness in a different manner did show its, did manifest in our handling of the COVID pandemic too. People were not allowed to return to their homes. People were, swimming across Mahakali just to cross the river to get back home, because they were not allowed to enter the country through the usual routes, and they were again, put in custody. And so that relationship has not changed much even now, because the state still hasn't learned to communicate with respect, with humility to people, and you can see the origins of that in that initial period also. And funnily, Susan mentions at one point our Prime Minister Tulsi Giri, who is a doctor by training, asked the US Embassy doctor for vaccines for his family. When and it was a time when there were the two journals, Rising Nepal and the Motherland, was reporting as high as 100,000 cases and over 25,000 deaths. And the government wasn't even acknowledging that an epidemic of smallpox was happening. And apparently the US Embassy leadership said that, okay, we're going to give you vaccines, but you must acknowledge that a pandemic is going on. And so state is for a few people and not for everybody. For Prime Minister, for people who have closer access to power. And that showed in a different way and sometimes similar way in COVID pandemic too. And then the other interesting part was how the relationship between the government and the INGO partners evolved. During our early development of the healthcare system in this country. And at the beginning, we had very limited expertise, and so it is natural that you had to rely on the WHO, the Southeast Asia Regional Organizations, experts, or other INGO partners a lot. They were, they talk about frustrations about, the Nepali government's, tendency to not follow up on agreements or, not do things efficiently and all that. But still, they were the ones really guiding most of the, strategy. Or even if the Nepali team suggested some changes that were, as Susan mentioned, very effective or useful, they had to be passed by the approved by the government officials one way or another, and that dependence, though, you would expect to change in the ensuing 3 or 4 decades, and during the COVID pandemic, at least, we were able to see how much dependent we were still with the INGOs. Put our initial approach to the INGO partners, the way we approach them, the way we talk to them, have led us in a path-defining way to this current dependent relation still. There are other countries which were similar to Nepal in the early 1960s, like South Korea. If you look at the development index metrics, we were very similar. But obviously, you can't really compare countries. But a lot of other countries managed to become far more self-dependent during this time, as we didn't. Are there any path-defining features in our initial approach to the INGO partners? You may interested, people might be able to find some of that information in this book. Regarding the things that I wish were there, I think the resources that Susan was able to dig up were still mostly from international resources, INGOs, governments, official history, or the correspondence between experts from overseas. And so even though she did speak with a lot of Nepali witnesses or participants in the program, the overall, if you read the book, it's still lopsided towards the outside perspective. So local perspective is still not as strong as she wanted it to be, I believe. I wonder if other resources, looking up other resources might help. For example, our daily newspapers looks like, from some of the paragraphs there, daily newspapers were commenting on the smallpox numbers, what was happening, what the government was doing. So, how many people were dying, and so if we could, survey the local newspapers of the days of those years, maybe we would have a little more stronger Nepali perspective. That is one thought that occurred to me, but there may be other resources too. I'll make my last point. The founder of social medicine, Rudolf Virchow, who is a Christian doctor himself, has said in one of his famous quotes, medicine is a social science and politics is nothing more than medicine on a large scale. The point where the smallpox vaccination program and smallpox eradication programs start to be introduced in Nepal, the point from where Susan picks up the story of this book is right after the ousting of a popularly elected prime minister's government in 1960 by King Mahendra. So before that, in the 1.5 years of the first popularly elected government in this country, we had an awe-inspiring, almost flooding of new initiatives, new enthusiasm, new sense of participation of the people in decision making. The audacity, their ambitiousness that you can see reading the stories of those 1.5 years is very different from the story of Nepal before that or after that. And that still catches the imagination of the country just by the sheer density and the ambition of their legislative successes. Just to give an example, in the first 3 months of that government, they managed to pass the Abolition of Kirta Act, which is the act that abolished privileged land holding arrangements for a large chunk of the country, just within 3 months. Currently, in the modern democratic Republic of Nepal, in 3 months we can't even form a government. We can't even form. We don't even decide on the name of the ministers. So the way I see that, I see things. The current healthcare system in Nepal, I see a lot of hierarchy, a lot of lack of imagination and lack of ambition. And I see a lot of bureaucracy rather than political imagination, because in the current system, in modern day Nepal. And when you, when the public is asked not to give ideas, not to ask questions, not to be proactive, then these big programs fail. Then the healthcare system doesn't deliver. Then you see what the international partners are complaining of, the lassitude or the inertia or lack of imagination or lack of enthusiasm when you don't have democracy. And I see that still ailing our system now, just onset of the panchayati system and the extinguishment of our democratic aspirations. And one of the big flaws of this system is the big flaws of relying on mostly government and INGO reports or those correspondence is that you don't get that part of history. You don't get to imagine what we could do better from that input, and that's one of the biggest flaws of this book. But in conclusion, though, it's a very rewarding read, a very worthwhile. She has really worked very hard, and she has really brought up a longer view, a wider context, and brings important lessons for us to learn, including the hopeful part that she mentioned.
Thank you, Anup. Would you like to respond to anything he said?
Well, I think just briefly, I think I'd like to thank you, Patush, for actually bringing us together so that we actually get this transdisciplinary discussion of bringing history and health together, because I think you've raised a whole lot more other things that I could never have done, and yet sort of highlight just how important that you need this solid foundation from which to sort of, in terms of develop health, develop things, the whole relation to politics, all these things. So I think I would like to sort of say thank you for doing that, because that is actually, with the book, what my hope was, that I could write something that could be acceptable in the by health people as well. So I had to learn some of that epidemiology, those terms, because it is no good writing it and not putting those in. Obviously, I couldn't, as you say, cover everything. I very much wanted it to be the Nepali perspectives. I was always conscious, ever since I wrote something for Patush for Sinhat, about the need to engage with Nepali sources. I have tried as much as I could, whether it's people, whether it's written sources, things that would bring in Nepali people's, whatever level, perspectives. That was always what I wanted at the forefront. Maybe we can do the newspapers as of something future, because many areas didn't have, the newspapers didn't cover things, and they weren't there sort of at the time. But it is a perspective that that sort of needed doing. I don't have the language, and even if I would need to have also, yes, there are English language ones as well, but I would really like Nepali sources as well. So maybe that's something that we could actually look as a project. As I say, I don't have the language, but working with somebody to bring that element, because I'm very conscious that the newspapers are not, there's brief mentions where I can, but all the time research is being done, whether it's being done in the newspapers or things, just like I could pick up some research done here on the telephones, which gave a different perspective. So I did try as much as I could. One of the things that I was very conscious when I wrote about was, as it goes through, you have all the WHO resources from that project. That was where the documents and things are. And you comment on at times that if that's all you had, the danger is that you see it from this outsider lens. And as a historian, a lot of time I was trying to, what I call, read across some of these sources to try and find other elements that told me more different, tell a different sort of story. So I think so. I would see the newspaper that could be a valuable health project going forwards, and I'd love to be involved. One fact that Nepalis haven't really written much about health and medical history. I have to, in some ways, thank you because it's given me an opportunity to actually do something of which, and I think you do. It was a labour of love in terms of that over much time, but it was also an extraordinary story, and I had no idea of the end story until I got much further through. And then the day I found a letter written by the head of the global program, actually acknowledging what was being done here could be useful for others, that just how valuable it was. So I think that is, you gave me an opportunity to be able to do that, so thank you.
Before I open the floor, you might have noticed there was a lot of text in one slide that Susan had put up there, but there was one date that I should have mentioned earlier, which is April 1975 is the last reported smallpox in Nepal.
Yeah.
For those of us who were born about 10 years before that and managed not to contract the disease, it's a miracle, I think. In my childhood, growing up in Kathmandu, I knew many people who had physical markers on their face. These are people who were not too many years older than myself, only about a few years older than myself, who would been born, I would imagine, in the late 1950s, mid 1950s. And so by the time I met them, they were in their mid-20s. So I'm talking about roughly the late 1970s when I was in school. People I knew rather well at that time who had scars of smallpox on their face. And in this room, we would, at least the older Nepali folks in this room would remember many such individuals. And so it's not only Frederick Gage's 50th anniversary of Frederick Gage's book that we'll be talking about later. It's very opposite. It's very important that we recognize that the 50th anniversary of the last reported case of smallpox in Nepal has just passed. So that was April of 1975. So if you have any questions or comments, what is it?
Yes. First of all, I would like to thank Susan for bringing out the research output of the research. I have two scars in my left hand here. They were given by a British retired army personnel who was trained to give this thing. As early as 1961, I was about 10 years. And my family lost 3 of my cousins because of this smallpox. I was saved. I don't know whether because of this or otherwise. So it was a horrible story. Every village, wherever there was funeral procession, one could easily tell that this is because of this smallpox. This is in Thapathali, a district which is, it takes 3 days of walking. There were no communications. Transport means from Dharan to my village. So thanks to that army personnel who was trained to give this vaccination, the people thereafter were saved. Like there are many contemporary relatives and friends and contemporaries where these scars or markers still there, and but we were saved. Thank you. I want, Dr. said the last case was 75. I wanted to know when it was the last or when it was the first. I don't know when it started in Nepal, but last was 75. I was wondering why this highly feared disease has occurred, what caused its absence. So I think I will definitely read your book whenever I find time. I usually do not read long books, but I will definitely read because this has affected my family as well. So this much about me. Later, when I was a school student in 1968-70, there there was a story in the textbook, Pioneers of Progress or something like that. In the book, there was a story about Dr. Zeller. I think he was a British, he was who discovered or invented this vaccine. I don't know, but it was told us. So this is what's.
Thank you for that. And this is what, as I researched, I kept finding. I would be somewhere and somebody would come up and say, "Oh, I had smallpox," or "I remember this." That it was so widespread. So for me, I love hearing the stories that what you have just talked about, because all of that. I keep storing that information and putting it in and trying to bring those different aspects in. Now, chapter 7 in the book, when I talk about a transition, I have the story from the doctor from the hospital, but also in that time is, you mentioned the army doctor and the army pope. There is.
He was not a doctor, just a person.
He was a person, and they trained and doing. But that Gurkha hospital down in Duran and things there, I did. Yes, it was the British Dr. who came out, but he talks about smallpox and he talks about vaccinating and he talks about the situation down. I came across him because he wrote a book which had a bit, but then he was still alive. He lived in England, not far from where my mother lived, and so I managed to, on a trip, go and talk to him about that side of things. But no, it struck me when I was doing this, that the number of people, and I think it just reinforces that while most of the world thinks of the smallpox program as a vaccination prevention program, for people here, it was about this devastating disease. And the big official history has nothing really about that. It writes about a disease in the past. It's not interested in any of that other stuff. But of course, for people and lives, that's what matters. And so that's what I kept trying to do, bringing those perspectives into it with that, because it doesn't mount into lots of piles of paper, and it's these stories. So thank you for that.
Just one supplement, just one sentence. My sons used to ask, sons and daughters used to ask, what caused this? And now my grandchildren are asking why. So I think your book I will be using it to answer this.
And it's not a very long book. I mean, if you discount all the pages dedicated to endnotes and bibliography.
That's for the academics.
That's for the academics. So the book's still under 300 pages. But if you ignore the endnotes, etc., the narrative itself is only about 200 plus pages. So it's not a very long.
I tried to make it readable.
Thank you. First of all, congratulations for the book. As a student of public health and anthropology, it draws my attention, enthusiasm, and excitement also. And following the comments from Dr. Anup and your excellent presentation, I have a few points to highlight and reflect. First of all, I think it is a huge, it's a very good knowledge resource for Nepal's healthcare professionals and policy practitioners to understand why social history of certain epidemic or certain disease is so important from the perspective of social and historical evidence. So this is one. And I liked it because you also highlighted about the local links and people's perspectives on the smallpox, how people feel about it and how they approach both the healthcare workers and how vaccinators also provide the services. It is a good combination between service provider and the end people, a kind of relationship on that. And third is, you also highlighted about the decentralized approach. I wonder, that time it was very good. The vaccinators were there at the local level, and the whole health system was dependent on the vaccinators, on smallpox and other polio and other such stuff. So I wonder, into this federal health system, whether we can a little bit learn from this kind of approach, eradicating the smallpox type of interventions to the local systems. I think this gives us a level of message to these modern health systems in the world. Lastly, because I have not read this book, but it seems to me that you have means all these information are from the secondary sources and some sort of your conversation with WHO and other Nepali health policymakers and others, doctors and others. I wonder whether you had time to really talk to people how they suffer and what kind of advances were there in terms of, vaccination that time. And lastly, whether I wonder whether you try to explore while eradicating the social history of the eradicating smallpox, whether you try to explore a little bit from the intersectionality approach, having some age group or gender and caste and that kind of thing, whether you tried in the book or not. So these are some of my curiosities. Yeah, thank you.
Quite a lot of those points do get, in terms of the archive, for example, I actually do mention when it is, for example, mention of Dalits, we're doing very few references, or like bringing in, I do comment on gender and different things a certain amount as well. Now, in terms of really at the heart of it, started from talking to it, and it's starting with Dr. Kathmandu, who's just gone at, but it was his talking about his family and the heartache or the what happened in family, in communities, and in fact that's where the actual book starts. Firstly with that story, and then I was able to come in 2015, just before the earthquake. My colleague Kieran, who's a pharmacist, he said, "Do you want to talk to somebody who had smallpox?" And he said, a friend of my father's. And so we met, and Kieran interpreted, and I learned all about this. And something that really struck me with that sort of with his story was that he was one of 3 children. His 2 siblings had both been vaccinated, but they had both died. Not necessarily from the vaccine, but he was the only child that was left. And therefore his mother did not want him to get vaccinated. So he got smallpox. The loving care from his mother, looking after, because it's painful, it was itchy, it was all these hot things that she looked after and doing it. So this is a very different story to what you hear about the smallpox program. 2 years later, I had some research leave, and I was able to come here, and Kieran took me to Kirtipur, and we talked to Syria, called My Grandmother Stories. We talked with people who lost children, who cared for children, what they did. It was all knowledge that they knew from within the family. Occasionally you might have another healer, but most of the time it was the loving care and knowledge from the family. They practice isolation in houses that have, say, 3 or 4 stories. They practice isolation, and the child would be isolated. One person from the family, usually the mother, would look after separate crockery, separate bedding, all these different sort of things. So these, she talked about, the different ones talked about religious beliefs, they talked about coming to the temple at Swaminar, all these different stories. That was really where I started from, and that's what I tried to bring in and come in and things. And this is why at the very end of the celebrations, which get held in Kathmandu. Initially, WHO wanted New Delhi, but then people have managed to get it so it's Kathmandu. And the Prime Minister and the two other senior officials each talked about different aspects of the programme. One of which was the sport of the king, one of which was the health service and developing and thanking people. The other was talking about the heartache from the perspective of the heartache of families. That children could be seen playing again, that families no longer had to have that sort of story. So that I think is what also the publisher, it's those people's stories. And that's how I also learned that, you know, if you just talk about beliefs, but you start, okay, beliefs, but then that story of deaths of siblings, or another one we talk about the side effects from something else and things, that all influenced whether or not they got vaccinated. And so it's bringing all that together. So that point is actually at the heart of what I've tried to do, and that is the whole people's perspectives that I've tried to bring in.
Thank you.
Sarah.
This might be beyond the ambit of what you're doing, but I'm asking you as a historian and someone familiar.
Yeah.
I wanted to take off from where Dr. Anup took off. Is there a paradox in the success of Nepal's smallpox story, and that insofar its success also laid the foundation, or was part and parcel of the story as to why Nepal currently does not have a well-functioning public health system? Beginning first, if we take off from what Anup said, he said that the public health system was just information. And if you look at your title, the implementing a global health program, you implement, and so basically the state becomes a service delivery mechanism. Yeah? And so it's unable to make its own policy, public health policy, structures, institutions, because as you say, the funding comes for that, and it gets implemented as such. And the history, as Anup has already pointed out, the history of Nepal's health structures, from donors, World Health, bilaterals, is of these what they call these vertical health systems, right?
Yes.
So you've got these vertical health systems that are not integrated historically and continue not to be so.
Yeah.
And so while there are many lapses of our states and of course our politicians, that there has been a foundation laid paradoxically because of the success of these global programs that has led to this situation. Could that argument be made?
Yes, very much so. There's a lot of criticism right from the beginning. There's the criticism of having the vertical programs and the horizontal and the integrated. And at the time, there's some of those districts, there were sort of integrated health services. The only time in the archives actually that I come across was a report of a meeting in 1975 where it actually brought people from the integrated sort of program. But no, it's a huge issue around, because the thing is, outsiders like vertical programs because you can set objectives, you can set things, you can see it sort of happening. And there's a lot of criticism about diverting resources into these vertical programs. And so it is an element all the way sort of through. You find that, and then I mean, what happens when primary sort of healthcare becomes the WHO focus? That's all too broad. They have selected primary healthcare very quickly when you can just have some targeted programs again. So it's good. One or two times in the book, I think it's after the It's the authors of the Nepal Health Survey. They do a book from 1965-66, and they really come to the conclusion that we should be we should be integrating, not these separate ones. What's in many ways, outsiders were finding it difficult to operate. They get more and more. It becomes this sort of world of sort of development and things. But it's nice to see that smallpox is perhaps where actually Nepal is enabled to develop and its people come for more. Part of that is, I think, due to a very quiet, respected WHO doctor who was originally from Sri Lanka, and thinks he never wrote anything, but he enabled the national project head to both develop, to speak at things, and in the book you find there's lots of places where he is writing and sort of doing that. I think so. It's a real problem, this vertical horizontal sort of issue, and that does sort of come out. I mean, I'm given a word limit, so I have to sort of can kind of.
So, but I'm saying that yes, part of Nepal's smallpox story for citizens, beyond that limited time period, is this exactly what Dr. Anup was talking about, right?
Yeah.
So to tell of citizen stories would, if you were to write a larger, with a longer space, has to be part of your story.
It has to be part, and this is what one would want to do. It was interesting just looking in some of the when people went to WHO and meetings of what they talked about, just hearing it. But no, I think that there's plenty of stuff. There's plenty of work to be done that I think is really important. I think I will just make one last comment, just sort of there in terms of, because the Ministry of Foreign Affairs controlled foreigners' access to Nepal, and they limited, whereas WHO practice, if there was, say, an epidemic or something, would be to flood with overseas people in to deal with it. Nepal's Foreign Affairs did not allow, I think at one point they wanted a fourth person to come in, and they said no. So that's why the smallpox program is very much, it's a national sort of, very much a national program in a way that perhaps others may not be. But there's plenty of work to be done.
Yes, please.
Yeah, and just following up on the point about the whole system, and I'd be interested after I've read your book, I haven't had a chance yet, but the FCHV program very much is the public health approach.
Yes.
And it's the backbone of Nepal's healthcare system to this day.
Yes.
In remote West Nepal, for example, you know, there's only one doctor for the whole of Bajra to deal with 100,000 people. So the FCHVs have a backbone, and they aren't medical personnel, they are community, and I wonder how much the smallpox program influenced the willingness to move to that FCHV program. And I know there's been, we need more medical, doing away with this, with the traditional birth attendants who were trained and moving, but still the FCHVs are the backbone of the healthcare system in most of rural Nepal, in many districts.
And that's why, to say there's plenty of scope, plenty of things, and we need to look at it from the perspectives of Nepal and people here, not necessarily from those over, outside sort of programs or funders. But no, I quite agree.
Well, I hope somebody will write a history of the FCHV program.
I just wanted to add to Susan's point about this question. So, could the success of the smallpox program have led the country away from developing a basic functioning healthcare public health system? I think the way I see it is the country probably had a decision to make, a political decision to make after Panchayat was started, and they were still thinking about how to run this country and how to defend the king's, ousting of the democratically elected government, how to defend, how to justify their government, a new system. So they probably could not say, oh, we want to focus on primary, basic functioning system rather than one disease, because then they would look like fools if they didn't, climb global bandwagon. And so they didn't have that courage to do it. But having done that, having still, adapted the smallpox program, I mean, what Susan mentioned shows that we actually did very well. We could actually trace each case to its source, not just in Nepal, but even to India, to what mohalla, what house number in India, we could actually trace that from Nepal. And we were giving that information to the Indian side. So even then, just for one disease though, we could still, show what this country can achieve if we, wanted to do. And so what I think was, there was great political opportunity to move towards, expanding the healthcare program and make it more, community-based, more prioritizing public health than, hospital-based healthcare. In the ensuing decades after the smallpox eradication. And because it was Panchayat and maybe a lot of other reasons, we didn't do it. And just the success itself did not necessarily mean that we had to go this route, but I think it was just a wrong political choices made, or lack of courage, or lack of imagination to involve. Regarding the question of FCSBs, again, that was a great program, great idea at the time when we started it. But I think we stuck with it for far too long a time. And even now we're talking about, using FCSBs for rolling out a lot of important things that they cannot, they are just too overburdened to, undertake. And so again, it comes to political imagination, your sense of accountability as the country's, leadership, about, what you can do, what this country can deliver. And this country is not so poor or so limited in its resources that it cannot have good doctors, good public health system in its village. I mean, I don't believe that. We can actually manage it. It's just the not having the courage or the imagination for that. So I think I can say thank you.
Are there any other hands? Yes, please.
Yeah. So thank you again for this inspiring talk and the discussions. I also noticed there's a few quick notes about the differences between the smallpox and malaria during the talk. And with my limited knowledge, I think that's because during, say, the 1950s to the 1970s, the malaria program is one of the most important as well as important programs in WHO. So I would just like to ask this short question, could you share a little bit more about your thoughts between these differences or the comparisons between the smallpox and the malaria? And maybe perhaps that's how you see these smallpox programs in Nepal become more distinctive?
Well, that follows another conversation that we had earlier. Yes, I was aware, I didn't really look that much in malaria. In terms of the global, the malaria is a global eradication program, and it was very controlled, very specific about the ways that you would do it. One of the things, the smallpox is later, it doesn't have budget or anything, it's not part of economic development. So I don't, and one of the things talking in fact with Dr. Rita Tarpa, who was one of the few one senior woman in this, what she that with the malaria program, you would go in and spray. You didn't care about people. You didn't do that. You would do sort of that. The smallpox, it's that bit later. There were some different sort of attitudes and things at the time. But the malaria, there was a lot of success with. This is the time when the Chautari is being enabled people to start living there, but also Pokhara. That was. Now there are quite a lot of sources. It's a completely separate program, so you don't really you don't find mention of malaria. It's, as I say, it's another of these vertical programs, but a very different way, and they really are. They're really siloed. Occasionally, some of the WA might have somebody they sort of know, but it really, I think, was because it was completely separate. So that apart from mentioning in passing, I bring a bit of that in, but in fact, again. This is where it's really good to have comments and things, because you can start thinking, well, okay, if you're doing it, I need to bring something more in here. I mean, again, these ideas ideas that we've got these very separate projects, but how do they link together? Do they? Because this is all part of, from the historian in me, wanting to know how. What sort of happens. I'm not going to say, at this point, I don't know. I would want to know more, and I want to dig sort of further, further down to the primary sources, to people and things to find out before you can then sort of see. But I think what your comments and the different comments that we open up is that there's actually a huge amount of work on projects that could be done that could be very helpful to have a better understanding. Because if I say that with smallpox, by going in with a longer and a wider sort of lens, that we get this better understanding, why shouldn't that apply to other things? And again, if you're just talking about Helen and the female community health volunteers and things, is actually digging down and looking more at it, how it's worked, what's keeping it, why, and you always have to think about money, and it's dropped, but a huge amount of what's healthcare expenditure in Nepal is coming out of development expenditure. And bottom line is, donors dictate the directions. Which is you might come at, end up with a similar topic. How they think about it will be different to how you think about it and what's sort of it's going on. And that, I think, because at this early point, and because it had much less of an influence in smallpox than it has done on other things, it's really interesting. But that domination by outside donors, so yes, money is needed, but it's like anybody trying to put in money for research projects and things. You have to address what what the donors sort of want, rather than maybe this. Because I did this, as you said, it comes out as a labour of love. I tacked it on to things. I didn't have to, and I had a supportive School of Pharmacy back sort of home. I didn't have to write reports for funders and things about what I was doing. So I was lucky I had an independence.
Thank you. I'll have to stop here. We're a little beyond time. In closing, I want to again thank Susan and congratulate her for actually getting this book. I've put together many books in my life, but I've not yet written a monograph. And so this is Susan's second monograph, and it's to me, as a historian, for 30 years I've been pointing out that we need more historians of Nepal who are not Nepalese. I wrote my first article on this subject in 1993, and I've been writing that almost just about every few years. I wrote one last year as well. And in the one that I wrote last year, I forgot that Susan had actually written this earlier book in her capacity as a historian. And I stand corrected in that, in the sense that when we have historians who are coming to write about different aspects of Nepali history and society, you get perspectives that might not be so obvious to insiders or natives or indigenous or what have you. And so the more historians from different nationalities and critical perspectives who work on Nepali history of the most recent past, the better it is for us to understand the past. As I said, I read the book, and when you read a monograph, obviously the best thing for the writer is it's a book that's done, right? So you could say the best book is a done book. You can take that attitude. So when I was writing my PhD for a very long time, I had a scroll on my screen saying the best PhD is a finished PhD, because for the longest time, people who have not finished their PhDs, I think, know, and there are people in this room, that when you wake up in the morning, the first thing that comes to your mind is, it's not done yet. And when you have Nepali, especially in Nepali, if you are a member of an extended family, everywhere you go, your relatives and friends will ask, "Sopyo?" And you get reminded that it's not done. So the best PhD is a done one. And so I think Sanjay Sharma recently has written something saying a best book is a done book. So when a book is done, and the author is actually spent many years as labor of love getting this book out, I think for it's others to actually build on what she's made, her work has made visible to every reader. And there are many things that could be built upon. And so obviously one area that really needs to be worked on, and I hope some Nepali young historian would do that, is precisely the area that you pointed out. And I was having this conversation with Susan earlier in the day, where on a particular budget, Nepali budget for the era in which she's writing, the budget for smallpox is 500,000 Nepali rupees. The budget for malaria is 17 million rupees. And then you have to immediately wonder, why is that there's such a discrepancy? And then you immediately begin to think about A, the era in which we're talking this, B, the malaria budget is actually helping to clear up the Tarai. And the whole malaria eradication story is absolutely crucial to our understanding of what was happening in Nepal in the late 1950s and 60s. And that is absolutely crucial to our interpretation of the fact that 50% of Nepal's population now actually lives in the Tarai. And without that malaria eradication programs, and it went on for many years, it would not be the case. In the journal, Sinha's journal, that is about to go to the press, we have a 50-page article written by Tom Robertson looking at malaria eradication in the Dung Valley. Okay, and that he's now made the argument that for a very long time we thought that the Kamaya system among the Tharus, Western Tharus, was a relic of a long lost past. And he's making the argument that it's quite probably not the case, that the malaria eradication program was a major source of making new Kamayas in the mid-20th century. And so, whether he's right or not, I don't know. But if he's right, that gives us, and he's made this argument very persuasively. As I said, over 50 pages, so I recommend that you read that. I also think that some Nepali, and it's probably not going to be people from my generation, but much younger, needs to look at not only the destruction of smallpox, but a whole host of other diseases that took away young kids from not only many parts of Nepal, but even in Kathmandu. Just yesterday, I found out that my mother had 2 young siblings who died at the age of 8, and her brother died at the age of 8 months. Her sister died at the age of 8 years. We don't know, in the family, my mom's gone now, we don't know if and what diseases took them. But if you read memoirs written by folks like Harish Shrestha, we read that memoir 20 years ago because we were working on on the history of Radio Nepal in Nepal, and Hari Shrestha was a very important broadcaster at a particular period in Nepali history. But when you read his memoirs, Hari Shrestha's memoirs, you realize that all of his siblings were taken away either by diarrhea, typhoid, what have you. And the older people sitting in this room would remember stories in our families where the reason that people had many children until very recently was because they could never be sure how many of them would actually survive to become adults. And this was not too long ago. I mean, my mother's siblings died, 75 years ago, roughly. So I think the eradication story, the malaria story, which is still going on, the smallpox story, is absolutely crucial to any understanding of 20th century Nepal, and I think it has repercussions that are quite obvious. And in the review that the draft of which I've read, Anup has written, he's made comparisons between the smallpox story rendered in this book and COVID-19 experiences in which, as a infectious disease doctor, Anup had a almost tragic first-hand location to do that. As I was also pointing out, this is my final point, I was also pointing out that Susan could have, given that we did have some newspapers and magazines in English during that were published in the 1960s. They are not very well archived, so it's not easy to actually look at them. We have one or two in our library here. So she could have read some of those and see if there were any relevant stuff related to smallpox in those publications. But we have to remember that from the 1950s on, there are Nepali newspapers, not necessarily Gorkhapatra, but also Gorkhapatra, that is now available in much easier researchable ways than was the case 30 years ago. That some other young historians would need to now go back after having read this book, ask some interesting questions and look at these archives. So I really hope that happens, and that would have been only possible because this book is now with us. Thank you, Susan.